Hi, in this video I'm going to show you some neural flossing targeting the nerves for the upper part of the body. So to begin with, I'm going to show you how to neural floss the more common ones that I will look at when we're in clinic for the ulnar, the radial nerve and the median nerve. So these are the three which come down from the neck and are coming down the arm towards the forearm before branching off to the nerves in the hand. So to begin with, we're going to look at the radial nerve. So you're going to want to be seated, and this nerve is running down and it's targeting more towards sort of the thumb and the index finger area. So for this one, we're going to have the arms to the side. I'm going to do this side on so you can see what my actual arms are doing. And so you want thumb up to one side, and then we'll want thumb down on the opposite side. Arms out to the side, and you're going to look towards your thumb up. And then all we're going to do is rotate to the head, turn to the face the other way, and the arms are going to rotate. So you're going to follow your thumb up, turning the opposite thumb down as you're looking away. And we're going to work like so. And you're going to do roughly about 10 to 15 reps of this, like so. Neural flossing is quite gentle, so you shouldn't experience too much of a stretch. You might feel a bit of pulling, you might feel a little bit of the numbness if you are experiencing any neural symptoms, but it shouldn't be too painful. So if it is, please stop and speak to a practitioner. Then we're moving on to the ulnar nerve, which is exactly the same movement, except this time round, rather than following the thumb up, we're going to follow the thumb down. So reset yourself, and we're going to follow the thumb down movement, like so. And again, you're looking to do sort of 10 to 15 reps with this one. The next one we're moving on to is the median nerve. So this one is running down more down the middle of the arm, hence the name median. And with this one, what we're going to do is bring the hand out to the side. The hand is going to be palm up, and we're going to do like a come hither type movement. So we're going to bring the hand up, so you're flexing that wrist, tip the head away, and then we'll tip and extend the hand, so you're pointing the hand down towards the floor. And we're just going to work like so. And we're going to do roughly 10 to 15 of those. And then you'll do exactly the same, but on the other side. Now, the next sort of bunch that I want to show you are ones that I will include if you do experience quite a bit of tension through the upper arm and the upper limb, and the upper body as well. So to begin with, we're going to look at what's called your spinal accessory nerve. This is looking at opening up around what we call your brachial plexus, sort of around the base of the neck here. So with this one, sitting nice and relaxed, what you're going to do is draw those shoulder blades back. You're going to send the head forward, so you're creating that opening in the neck. And then all we're going to do is tip the head one way, and then tip the head the other, and then relax. And we'll go again to retract those shoulders, send the head forward, tip the head one way, tip the head the other, and then relax. And you'll repeat that again, sort of roughly 10 to 15 times. Again, like before, it shouldn't be causing any pain. It may feel a bit of a stretchy sensation, but it shouldn't be too strong. If you might experience some tingling and numbness type sensations if you are experiencing neural pain, but it shouldn't be too intense, and this exercise certainly shouldn't aggravate. So if it is, please go and speak to a therapist to investigate a little further. Moving on, we're going to look at your musculocutaneous muscle. So this is looking more sort of like in the upper part of the shoulder region now. And for this one, we're going to create a fist with your hand, but you'll need your thumb tucked in. We're going to send the arm back behind you into the extension movement, and then we're going to take the wrist up and down, so we're moving it through what we call ulnar deviation and radial deviation. So you're doing that sort of movement with the wrist behind you, like so. If you want to add more, you can take the tip of the head away, so you're fully opening up through this area. And again, you're looking sort of 10 to 15 reps with this movement. And the final one that I'd like to show you is one of my favourite ones, just because of what it reminds me. So you are going to target what's called your suprascapular nerve, and we're going to do like what I refer to as I'm a little teapot movement. So you're going to bring your hand up towards your ear, tucking the hand behind the head, and then all we're going to do is move the head away from yourself and then into it, away and in, like so. And again, you're looking sort of 10 to 15 reps doing this movement.